Hello everyone, my name is Dr. Reddy. I am a consultant radiation oncologist in Kaizen Oncology and Oncology Network. Today, let's discuss about the topic diet during radiation. I'll address this issue in two ways. One, what is the food we need to eat? What is the diet we need to have? And two is what is the diet we should avoid or types of food which we need to avoid during treatment, during radiation therapy. What to eat. During radiation therapy, we follow a simple three rules, which is one, having calorie dense foods, two, preferably having semi-solid and liquid diet, three, having food in increased frequency. So coming to the first one, which is having calorie dense foods. So there are mainly calorie dense foods are the type of food which taken in even smaller quantities, they supply high amount of calories to the body. So if you look at the calorie dense foods, so that is high protein food, high fat food with some amount of carbohydrates thrown into it. So especially like chicken, eggs, especially for non-vegetarian, chicken and eggs are the best one. And for the vegetarians, beans and nuts would be the preference. Even the high fat food implies especially the yogurt, curd, cream. So these are the types of food which are calorie dense, and even these foods are added along with the normal diet. They make sure that good amount of nutrition is supplied to the body. So coming to the part where we discuss about liquid and semi-solid diet, especially in patients like head and neck cancer patients or esophagus patients, they have difficulty in swallowing because during the treatment into the third or fourth week of radiation therapy, they will develop some mild difficulty in swallowing. In those situations, we prefer to make sure that their intake is not compromised. So liquid foods or semi-solid foods in the form of protein shakes, smoothies, Greek yogurt, buttermilk, these type of foods are encouraged so that the energy levels are not down. If we can maintain the weight of the patient, if we can maintain energy levels, the treatment will not be compromised. The treatment delivery will not be compromised. The last one is having multiple meals per day, because generally we think about having food 3 times per day, which is morning, afternoon and the evening. But when we have food multiple times in a day, so that makes sure that there is no satiety feeling, but at the same time the amount of food overall can be increased. So making sure higher amount of food is taken will make sure that the higher amount of energy is delivered to the body. So what to eat is calorie dense foods which high in protein and high in fat. Second, making sure that even when there is some difficulty in swallowing, having liquid and semi-solid diet. Lastly, multiple times or increased frequency, rather than eating 3 times per day, making sure we're eating 6 to 9 times per day, and overall making sure that the body is receiving high amounts of energy. The last one, what not to eat. So what not to eat is it's patient specific, but on a general basis we say don't eat very hot food and very cold food, and spicy foods avoided because they can cause stomach upset, and preferably no fried foods. These are one of the things which are recommended. And one more is some patients actually develop gastric upset when they take curd or citrus fruits, especially like amla, lemon. So when these types of foods are taken, they can cause a gastric upset, or especially in the head and neck cancer patients, they can cause some pain in the mouth. So these types of foods are avoided. And one last very important part, so which is maintaining adequate hydration. So this has to be maintained because general population, like normal people, take at least 3 liters of water per day. But when the patient is taking radiation treatment, they may feel some the desire to take adequate amount of water will not be there. So they make sure that we'll take later, some other complaint, some other reason they say. but the adequate amount of food or hydration is not maintained. So making sure that at least 3 liters of water is taken by the patient is very important. So what to eat, what not to eat, and maintaining adequate amount of hydration. So following these type of tips during treatment will make sure that the patient is full of energy, the side effects are repaired easily during the treatment, and the overall treatment time is not compromised. Thank you.